Okay, it's live streaming, it's recording.
All right, thank you. Good evening, everyone. This is a meeting of the Health and Social Services Committee on Tuesday, March 12th. We're in the board office. Hopefully, we will get more of our committee members online, but we will introduce ourselves. I'm Sandra Unger.
Cynthia Rodriguez, committee member.
David Levitt.
Joanne Rubino.
Right, and we don't have the minutes. We'll forego them. But we have two guest speakers tonight, Danielle Parks and Dr.
Is he here?
Not yet. Dr. Coulter. So I'm gonna let Danielle start. Danielle, do you want to introduce yourself and explain what your program is about?
Yes. Can everyone hear me? Okay.
Yes.
Okay. Well, good evening, everyone. My name is Danielle Parks, and I am part of Bronx Pandemic Project. My team and I are on this call today, Professor Heather Archer-Dyer and Tella Bolton. We do have a Google presentation, Google Slides presentation, if that's okay to share.
That's fine.
Okay.
Let me see. Hold on. I think you may have to send it to me or, oh gosh, I forgot how to do this. Share.
Or do you share from?
Can you share on your end?
Yes.
Let's see.
You would just have to give us access. We have the ability to share.
So how do we give access?
Good question. Let's see.
Can we ask Jeremy?
Good. Jeremy.
Should I go and ask him?
Jeremy, sorry to bother you. Can you hear us?
I'll go.
I'll go.
I got him up there. This one. We need his technicals.
Jeremy.
We're trying to get the additional support services.
What about the top menus? Is there anything there?
Or the layout.
So there, it's for them to share.
Yeah, so just like ours, so who Danielle wants to share?
Yes.
Yes.
Yeah, no, so Danielle, can you hear me?
Yes.
So at the bottom of your screen, you see where it says mute, stop video, share?
Yes.
So click on share. And then share the program if you have it open, or just share your screen if you're okay with everybody seeing your screen, whatever you prefer.
Okay, yes, it says to open up my system preferences. So I may have to leave the meeting and then rejoin, I guess. Or if it's just easier, I can just send it in the chat for you to share it.
Yeah, I mean, it's up to you.
I don't know how.
Yeah, I
So
can.
it's on a website.
Yes, it's on Google Slides. So if you have the link, you should be able to open.
So when you clicked on share, what did it say? Your screen.
It says I would have to grant access to it, but I will have to leave the meeting, I guess, to quit and reopen based on my settings.
Oh.
Yes.
So what if she?
He's gonna leave the
emails it to
meeting,
me?
do something,
How about
and
that?
come back on.
Yeah, so okay, yeah, if you want to do that, I mean,
Okay, I'll try that.
I could try. Yeah, I don't think I could make you a panelist, but I don't think that'll matter.
Is she still there?
Yeah, or Cynthia could do it she gives you access.
Is it you said it's Google Slides?
Yes.
She said it was a Google program, yes.
Try emailing it to me.
Okay.
Never.
I have a little book with all my things.
I always think.
So, also just for the record, so Juanita's online. I think Susan just joined online.
Yeah,
Okay, yeah, you circled Juanita.
Yeah.
Circle Susan. I'll make you a co-host, Cynthia.
All right.
I just stepped into the house. Just give me a few minutes. I'm just gonna turn the camera off and I'll be right back.
Who's that?
Susie.
Susan Perez.
Oh, okay.
I've sent it.
All right, let me try to see if I can.
I put it in the chat if that was easier.
Oh, let me try that. Oh, there you go. That might work. The external site continue.
External site, okay. Oh, there it is.
There it is. Got it. Where am I?
Working together, we had it.
I have to pull it now. How do I?
I left the meeting and I'm able to share my screen, I think, now.
Try it, Daniel.
Okay. I think you all can see the screen.
Yes, I can see the screen.
So I'll start if that's fine with everyone. Thumbs up, that's okay? Or
I see one thumbs up, yeah. You want to put it in presentation mode?
yes.
Yeah, that's.
There we go.
great.
That's
what-
it.
Thank you.
Okay. All right, great. So I am part of, again, my name is Danielle Parks, and I am part of the Bronx Pandemic Project. And this is a CDC funded project, which includes Albert Einstein College of Medicine, as well as Cornell University Cooperative Extension in New York City, which I am a part of.
Good evening, everyone. My name is Heather Archer-Dyer. I am a part of the Einstein version of the team, Einstein College of Medicine. Can everyone hear me?
Yes.
Okay, I just want to welcome you to just our session. Some ground rules that we like to make sure that we reinstate is making sure that everyone is comfortable with updating their pronouns. Mine is she, her, hers. Well, we normally say remain muted, but everyone's in the room and we're in different spaces, so it may not actually make sense to state that. If you have any questions, feel free to stop us at any time. We like everyone to participate as freely as possible. And we want to make sure that everyone has a chance to ask questions. And so we want to share space equitably. And we want you to take care of yourself. So if you do have to leave the room for any reason, do not feel that it would interrupt the presentation. We do not have any conflicts of interest to disclose. But it should be, oh, I'm sorry. Can you still see the screen?
Yes.
Yes.
We do not have any conflicts of interest to disclose. And everyone here is here because we want to be. Danielle, if you want to do our learning objectives.
Sure, yes. So while we present about our project, these 5 learning objectives, we intend for uh, y'all to be able to get through. So informing the community board, 11 Health and Services Committee about the Bronx Pandemic Project, highlighting the role of community health workers and collaborative partners in effective community engaged research, describing our programmatic structure, disseminating the methods, procedures, and practices of year 2 and year 3, which we are currently a part of in this grant project, of the surveys of perceptions, or SOPs survey data, which you will learn more about during the presentation. And finally, inviting collaborations with members of the Montefiore Einstein community, which we are a part of, but also with the Community Board 11 and you all. And these are our agenda items. And as we go throughout the presentation, you will see we will go from 1 to 6. So the first one, again, welcome. So on this call and part of this presentation is Professor Heather Archer Dyer, myself, and Kella Bolton, who is one of our interns as well as an MPH student.
So now I'm just going to go into our second agenda item, which is pandemic, just to explain what pandemic is and what the goals are. And so what it actually stands for is the Program to Alleviate National Disparities in Ethnic and Minority Immunizations in the Community. So that's a mouthful. So we just call it pandemic for short, or Our Community, Our Health, which is the logo in the bottom right of our screen. Our Community, Our Health was also a part of this grant. And I thought it was more user-friendly, if you will, with our community members instead of calling our program pandemic. So essentially, it's a 3-year funded grant from the CDC. It is led by the University of Florida, and Einstein is one of the 8 project sites. The project sites are listed on the right so that you can see who we're actually collaborating with. We meet with the University of Florida and all the stakeholders once a week, and we also have a twice monthly meeting for all the sites to report exactly what's happening and what new innovative ways they've come to engage with the communities that they're involved with. Our project mission is basically to share the most up-to-date and reliable information for adult vaccination. While the original focus was COVID-19, we have expanded this to make sure that whatever is currently impacting our communities. So when the RSV outbreak started, when the flu outbreak was, prevalent as well, we wanted to make sure that we gave information in all the different vaccinations. And so what we ended up doing is partnering with another grant who was focused on childhood immunizations so that we could cater to the entire family. Next slide. So just our project structure in a nutshell. The national project is ran again by the University of Florida. Linda Kotler is our PI, and she's from the University of Florida. And then we have 8 sites, and we have 8 different PIs from different clinical and translational science centers. Ours at Einstein is Dr. Hal Strelnick, and he is the PI for our work with the cooperative extension, who Danielle is here also representing tonight. In terms of our additional partners, we have a media partner, which is Health Literacy Media, and they basically translate documents into multiple languages, and they give us the support in making sure that any handouts or information pamphlets that we hand out is accurate, is at the appropriate literacy level, and again, is translated into the appropriate language so that our community can be met wherever they are. Then we have a National Community Advisory Board, and these are all our partners on the right-hand side in the purple box. So we have, Dr. IJ Anasoki, and she is a pediatric infectious disease specialist. Larry, who is from Tufts Medical School. Justin, who's from LaGuardia Community College. Nana Ama is one of our Bronx Community College interns for this. And we have Kenny, who's from Bronx Health Reach. Claudine George, who's from Einstein. She's also an MD. We have Dr. Leon. Actually, no, Lismar is also a student, pardon me, from Bronx Community College. Dale Miller is from Weill Cornell Clinical Translational Science Center, as well as Sandra Reyes, who runs a nonprofit in the Bronx with us. These are all our stakeholders, and that's our board who constantly gives us different access. Like tonight to Community Board 11, Dr. Dale Miller was the instrumental community partner in our steering committee that gave us that access. So I'm a co-PI on the grant, and I'm from Einstein Montefiore. And then while Cornell is a large stakeholder in the grant, and Jennifer Tiffany is the executive director for that extension cooperative. Our 3 community health workers from Einstein are Jackie, Ray, and Armando. And they are the ones that actually go out with Danielle to make sure that we're doing our community health needs assessment as well as our surveys of perception. And then, of course, our Bronx community partners. We wouldn't do any of this work if we didn't have our Bronx community partners who actually invite us into multiple spaces and support our project. Next slide, please. So this is our wonderful team. So Dr. Strelnick is placed top left. That's actually me. I just cut off my hair for catfishing your picture. In my picture. But that's actually me pre-pandemic. Armando is next to me. Below Armando is Danielle. And to Danielle's left is Ray. And then to Ray's left is Jackie. Jackie was our actual first community health worker hired in this space. Then Ray, then Armando. But Danielle has been here from the beginning, even before me. So we provide health educational information to make sure that families, as well as individuals and whatever organizations that want to collaborate with us, we make sure that we're giving them professional communication and the most up-to-date, accurate information that we can possibly provide. We also have different handouts and as well as different, incentives that we'll give out. Danielle will get into more of that later. So we basically connect with CEOs, ones that we've worked with before, ones that partner with Einstein, ones that partner with Montefiore, that partner with Danielle and her work, that partner with Ray and his previous work. Armando has also brought in, and Jackie is basically like the face of the project. She brings in majority of the partners. But we also have vaccination services and BP station. Our BP station are provided by the Einstein Free Clinic, who are majority medical students, and they do the BP stations, and they also do some health information around blood pressure and blood pressure monitoring and screening. Next slide, please.
BP is blood pressure, right?
Yes,
Actually, I think she's talking about the program name.
Yeah.
BP is blood pressure, correct.
Oh,
Thank you.
No problem. I told you, feel free to stop me anytime. So for our outcomes, we broke them down into short-term, intermediate, as well as long-term. And what we have been able to actually see is we've identified a lot of misperceptions about COVID, and we were able to try to, debunk a lot of the different myths that were going around about COVID, like the nanoparticles, the tracking, like we've heard a lot of stuff. Danielle and Armando can tell you more. Armando's not on the call. So Danielle can tell you more if she wants to give you some of the different misconceptions and perceptions she's heard.
Oh, yes.
Yeah. Go ahead, Danielle.
Oh, yes. When we get to I don't mind sharing, after when we get to the surveys of perceptions.
Okay, sounds good.
One of our tools, yes.
Okay, perfect. So we made sure that one of our goals was to increase the education and correction for any misinformation, especially around COVID and the flu vaccine. Because again, we've heard a lot of different information that our community was not privy to. And then expanded our network essentially of community and clinical partners so that we could have vaccinations, we could have different stakeholders providing different information for the various populations that we have throughout the Bronx. I'm not going to go through all of them. We can give you a copy of the slides because I just don't want to read off the slide. Next slide, please. But as a part of preparing for this work for our community, our health, we wanted to make sure that we implemented the project and we conducted a needs assessment that was in line with what our community actually needed. And so by doing that, we were able to identify different areas that was important to our community. So in the identification process, we went through the different strategies that the CDC wanted us to hit. And so we wanted to make sure that it was equitable distribution, that we administered or made sure that the vaccinations were available if we had partners that were interested in the vaccinations. But we wanted to make sure that the 6 promising practices for vaccine equity we adhere to as much as possible throughout the intervention, and to make sure that adults that were interested in these vaccinations were actually being serviced the way that they wanted to be serviced. So we gave the largest voice to our community partners so that they can lead the directives.
And during our outreach events, which we will get more into, we conduct an anonymous survey of perceptions, which helps us to understand better the community's attitudes, questions, concerns, areas where they want to learn more about COVID-19 vaccination, as well as the infectious disease itself. And we provide goodie bags and different incentives that include personal protective equipment such as masks, sanitizer, gloves. And the pictures to the right, you see members of our team engaging with community members at different outreach events where we provide information on different infectious diseases, as well as engage individuals to complete the survey of perceptions. And again, here are some other examples of our giveaways, incentives, and media that we provide at our outreach events. You see there's even, socks, activity books for children to complete, coloring books, sanitizer again, and you see there's a thermometer as well. So we try to understand which communities we are going to and tailoring a lot of our incentives and information to the particular community.
And a lot of these goodie bags that we've, packed, most of the supplies came from New York City Department of Health. And a lot of it also came from our surplus station in New York City. And so we didn't have to spend a lot of money. So we made sure that we gave it out freely and without hesitation.
Yes.
If I may ask a question, I know you asked for some tables at our health fair in June.
Mhm.
Will you be having tables like that with the giveaways?
But of
So that we
course, it's a
can,
must. Definitely.
Yes.
It's a must.
Definitely, or are we gonna put that on the flyer?
Yes,
Okay.
definitely.
Making
Definitely.
sure. Thank you.
My pleasure. My pleasure.
And now we'll go into community health workers and their role as being integral to this project, as well as our interns, including Kella Bolton, who's on the call today too. We have a quick video on this side. You can see one of our community health workers in action, Jackie, at an event in the Bronx at St. Luke's Episcopal Church, and that's myself there. And we see community health workers are part of the community who work with local healthcare systems, and in our case, an urban environment. And again, usually are able to identify with the communities that they're serving. and community health workers in the context of Bronx pandemic, again, offer information that's up to date on infectious diseases, immunizations in the community. We connect individuals to health services, and we do a lot of advocating for individual and community health needs, and connect community members with various services such as blood pressure screening, Narcan training, mammograms, and also provide medical referrals, which we will get more into as it relates to our project. And Kella, if you'd like to add anything as well in terms of the work.
Or, the outreach programs, the Bronx Pandemic has conducted many outreach programs since 2022. And I've been to a couple of the programs, and they're really great. They've really informed the members of the community. I think that from what I've seen so far, from my observation, the members in the community feel comfortable speaking about certain things, and I think that a lot of the information they get is valuable. And of course, people always like to come to the tables because you're getting free things, right? So that's also an incentive for them. And always just to learn more information, right? Because I think that a lot of issues surround the fact that people are just not educated enough sometimes to make the right decision about what's best for them. So I really, really love the outreach programs. I wish they would never end, right? I wish they would never end, and they have just been so valuable for members of the community. Thank you.
Thank you, Kayla.
And again, in addition to attending outreach events in which we are invited to, and where we may tailor specific information, for example, on breast cancer awareness, we have media as created by our health literacy media partner, provide information related to immunizations, for example, COVID-19, with or as it is impacted by cancer and vice versa, or with other types of comorbidities such as asthma or COPD. And we also coordinate and tailor outreach events in partnership with community partners. For example, in January, we collaborated with Brady Court Community Center to provide information on COVID-19, the flu, and other immunizations, as well as linking our vaccine and vaccination unit partners, such as VIP Community Services, to be able to provide vaccinations. In addition to vaccine units, we also work with community partners, including Echo Clinic, which is the Einstein Community Health Outreach Clinic, which is a free clinic run by medical students of Albert Einstein College of Medicine, in which they provide free healthcare to individuals who are underinsured or uninsured. And again, I'm a part of Cornell University Cooperative Extension, and we have a nutrition and health program in New York City. So on the right, the bottom right of the picture, or the bottom right picture, you see here two community educators who teach free nutrition workshops. And so also linking our nutrition and health program to these events as well, and signing people up as well to be engaged with these programs in the community and in the Bronx. And Armando Martinez, who is a community health worker on this call, or who's a community health worker on the project, is on the call if you'd like to add anything.
Danielle, we have a question in the chat.
Okay.
If we have any of the events that are upcoming that we can share. I know we have a slide on it, so, but in addition to those, do we have any, like, for the longer projected time?
Yes, we have for June with the Community Board 11, I believe June 23rd.
Yes.
Event. Okay, yes.
And we set aside 3 tables that you
Oh,
asked.
great. And April 23rd, we will be at the Brady Court Community Center with Sun River Health to provide vaccinations as well as to table and provide personal protective equipment and to conduct surveys of perceptions as well.
And we also give out the at-home COVID-19 tests so that participants can, you know, not have to purchase those either.
Yes. And again, these are some examples of health literature that we provide at our outreach events.
Yeah, I got the shit. I just heard one.
To get it.
Oh,
Mpox.
you know, get it.
Monkeypox,
The
Mpox.
baby-
And this is also some health literature. Since we do, again, focus, or this project is specifically focused on adult vaccinations, we still get questions related to pediatric vaccinations as well as family vaccinations. So we do provide information on family vaccination, as well as in the past have partnered with an Einstein colleague who received grant funding to address vaccine hesitancy and around pediatric vaccinations. So this is, again, some information related to family vaccinations.
And if you want our colleague to table with us on the 23rd, you could just let us know, and then we'll have some pediatric support as well. And they can come along, and they also do BPs for the children, and they do different stations for the children, just focused on pediatrics as well.
So, point, do you need I'm setting aside 3 tables. Do you think you're gonna need more? Because I have other.
It depends on what you need. So if you want our adult vaccinations, VIP will need tables on their own because they're a whole different entity, and they would need space in where they can privately give those vaccinations because they don't want to.
Oh, wow.
Yeah. So a screen would do. They have the screen, but just a section where
And
that
they would
screen.
have to be in the back, maybe,
that-
by a wall.
Right.
That could be arranged, all right.
Right. And if you're interested, like in the mammography van or the dentistry van and stuff, you just have to have parking for those because they would be outdoors.
That's
difficult.
Yeah. So it depends on what services you would need, and we would tailor your event to your needs, and we would make sure that we have all the things that you request. So if you say, hey, I want the Shingrix vaccine or the monkeypox, whatever, then we would be able to say and request in advance. And then there may be a registration link because they want to make sure that individuals will show up for these vaccines because they pay the staff for the time that they come out. And there's an insurance waiver that they pay, not us, not you. So they want to make sure that people actually show up for. If you say, I want 10 mammographies done, you have 10 people, they'd have to register in advance. So that would be just like a process that we can discuss offline.
My other question is Shingrix is a 2-part vaccine.
Correct,
And then the second one 2 to 6 months later.
correct. So
So-
you'd have to follow up with a Montefiore physician that we would send you to.
Thank you. Thank you.
You're welcome.
Hi, I have a question. Do you have any mental health services?
That's a very good question, and it's a question that I've been working on. I partner with an organization called Fountain House,
Okay.
and I've been trying to get them more into the community. It's completely voluntary, and the members actually run the clubhouse. And I haven't officially added them to our collaborative, but if you would request them for this event, I could have them come for June 23rd. I have enough time to give them a heads up.
Question.
This Fountain House.
Yeah, I've heard of the Fountain House.
It's an amazing organization. I love
Yeah.
them. I've been working with them for I've been at Einstein for 12 years. I've been working with them for 7 out of the 12.
Wow.
So it's one of my favorite organizations in the Bronx.
So we may set aside 4 tables. I better know that.
Our table grow with each slide.
Wait, I'm sorry. I have another question. I might have missed it. Will you have a table like for people who have to sign up for like maybe medical insurance? I know you mentioned something about low insurance or no insurance.
So that was a part of our Echo Clinic, but we do have a partnership with Metro Plus and Health First. So we could easily have them table, but they would be like a part of one table, and we can work out the insurance initiative if you would like. Yes.
Thank you.
So they can arrange a lot for us.
Yeah.
Yeah, we can raise that.
Right.
You know, I wanted to
Any
ask a question.
tentacles. Yeah.
I wanted to ask a question about, I know the pediatric immunizations are very, very low. So
Okay.
I think having a table, just to deal with pediatrics, may be something very good. Because a lot of parents do come to the Bronx House with their young children, or they have young children, there's, you know, so that might be
Bronx House is
something.
right up the block from Jacoby because that's where the partnership is. It's a
Yeah.
AMC grant with Dr. Christina Coyle, and she's an infectious disease doctor, but Dr. IJ is also a pediatric infectious disease physician. So we can definitely reach out to them now to see if this would be available, and then we can be in in communication and let you know if they would be available to do any consultations, as well as we can see if VIP has the pediatric, or I think it's Essen that they work with, they ESSEN. I'm not sure of their partner, but their partner is different than our partner because our partner only works with mostly adults.
I see. Thank you.
Thank you.
Something that we can definitely explore and find out, and we can, talk about it offline.
Yeah, so Danielle and I will be in contact and we can work it out.
Yes.
So Danielle would be the point person for our upcoming health fair?
Yes, and you can CC me so that I can reach out to the contacts that Danielle, like Fountain House, it's mostly me. I can reach out to the additional services that you're looking for, like mental health. Danielle works with the pediatric group. I don't need to interfere with that. But she can put you in the right direction. But I'll reach out to Fountain House just to be supportive and see if they're available to come out.
Thank you. What about free eye exams? I don't know. My brain is just going. I'm sorry.
Yeah, no, I don't have any free eye exams, but that doesn't mean I can't like contact a couple of partners that could be useful in saying, oh, you can go here or there. I can investigate, but I don't have a partnership.
Okay. Thank you.
Mhm.
Thank you.
And in addition to the different topics that we share, we also offer the media in various languages, knowing that in the Bronx, a multitude of languages are spoken besides English and Spanish. So on the screen, you have examples of our media in, we have English and Spanish, but in other languages as well. We we've collaborated a lot with a Bangladeshi community in the Bronx called Shakna, and majority of their the individuals that they work with speak Bangla. So, for example, we've had media translated into Bangla as well for communities that we work with in the Bronx.
Yeah, we have a large Yemen population in our area. In fact, they call it Little Yemen. So do you have anything in the language?
We can see if we can get it translated. I know we've done Twi, we've done Hausa, Arabic, Albanian, Bengali, Urdu, and Spanish. But we don't have currently anything, but we can reach out to Health Literacy Media to see, because they're the ones that do all the translation for us.
Yes.
They use Arabic.
Yeah, I don't.
Yeah, we do like Arabic.
Yeah.
Yeah,
Mhm.
I think
Thank
that's
you.
what it is.
yeah, maybe they, okay.
All right, so just to go into our steering committee, excuse me. So our steering committee, like I alluded to earlier, these are pictures of all of our steering committee members. and essentially they advise us and support us and make different connections for us so that we're able to, do all of this work. We wouldn't be able to do this if it was just on the strength of myself, Hal, Danielle, and like Jackie, Armando, and Ray. We have this entire wonderful group of individuals that have extensive networks, and they allow us contact with their networks, and they basically set us up for success. And so that's the way that we've been able to develop all of the different relationships that we have and all of the different connections. Without them, this project would literally, I don't think it would have worked because the funding has been crazy. They've cut our funding so many different times, but they are basically the glue that holds us together. Next slide, please. So this is the steering committee. So again, they're trusted advisors. They give us any partners that we need. They are basically a multi-directional group. So it's not just a group of doctors, it's a group of interprofessionals. Like, so we have everyone from nurses aides to nurses. Like, we have students, we have medical students, we have college students, we have transitional students, MPH students. And so that's why we're able to stay innovative and able to answer the calls and the overall recommendations that are required of us. And they basically ensure that our community research is actually community-based. And that's what it's, the best thing about us. It's community helping community. And so they gave us, again, unprecedented access to their networks. And that's the only way that our connection actually continues. And it's something that I wish that can continue, just like Kella said earlier. But funding is a major issue because our funding does stop in July. And a lot of this work can't be done without funding, but we always find a way. And I think we're going to still push to make sure that we try to find a way to make sure that the community helping community continues. Next slide, please.
And as we mentioned before, so the National Pandemic Project links clinical and translational science centers and medical schools to extension systems and educators. So again, in our case with Bronx Pandemic, the Clinical and Translational Science Center at Einstein Montefiore is working with Cornell University Cooperative Extension, New York City. And at our events, again, we seek to connect Cornell's programs such as our 4-H program, our nutrition and health programs, to outreach events in order to connect our community members, not just with information on vaccinations, but to link to other resources in the community as well and services. And now we're going to talk about our survey, the Survey of Perceptions, which is a qualitative research tool that we use to better understand community members' thoughts, feelings, recommendations, questions, concerns they have about COVID-19 specifically, as well as immunizations in general. On the left, you can see some questions that we asked individuals, including their viewpoints on vaccination, which one describes them the best, who they trust the most to give them information about vaccines, how much individuals trust research, trust researchers, if they received the COVID-19 vaccine, and when was their last COVID-19 vaccine given, the boosters that were available, as well as the latest vaccine in September of 2023. It's completely anonymous. We just asked for individuals' zip code. On the right, you can see an individual at one of our outreach events completing a survey of perception.
Who gave us permission to use her picture?
Oh yes, we have a waiver that we give to individuals, asking if they're okay with us sharing their pictures. And again, on the left, we have other questions. It's one page front and back about people's feelings, whether they agree or disagree about certain statements about COVID-19. Please note that given the pandemic, or COVID-19 we were in a pandemic phase and now we are in an endemic phase, that the questions of the survey have changed to reflect that, as well as state and national mandates.
So this is my favorite statement. You can ask my actual children. I say this every day: teamwork makes the dream work. And our amazing collaborators that we've worked with in 2022 are all listed here. This list was updated as of March 12th, 2024. And the two newest projects that are part of our team are the Brady Courts that Danielle just told you we have an event coming up with, as well as Engage Bronx, who's a food pantry in the Bronx. And that's a collaborative that Armando has, graciously supported and signed us up with. Our two major contributors are, I alluded to earlier, Dr. Christina Coyle, who's an infectious disease specialist at Einstein and Jacobi, and then Dr. Brenda or IJ Anasoki, who's a pediatric infectious disease specialist at CHAM, which is our children's hospital. Another collaborative that has partnered with us and has given us amazing support and some valuable resources and outreaches is the Dennis Gardner Community Relations team at Einstein. And they have provided us multiple tabling spaces at multiple events, even the Bronx Night Market, which is amazing in and of itself. But we also have Castle Hill YMCA, who has been also an amazing collaborator and has brought us in for workshops and all kinds of different events. VIB services, again, they provide our vaccinations. Their mobile units are amazing. We also were able through them to go to the National Night Out event, which was huge in the 5 boroughs, and I think we got over like 80 surveys that night. But the point is, again, teamwork makes the dream work, and that's the only way that we could have done all of these different surveys, these assessments, and in order to make us even more, successful, we partnered with the vaccination van. Next slide, please. So to administer the surveys that we've
the GOLD project, okay.
the BOLD Cancer Center, they're one of our biggest program. BOLD stands for Bronx Oncology Daily Living Program, and they have provided us, again, major information on surviving cancer, all different types of cancer, because they work with the Cancer Center, and the resources that they provide are invaluable. They also provide, great spaces for individuals who are survivors of cancer, breast cancer, colon cancer, ovarian, etc. And they do a lot of different resource outreach driven to, support cancer survivors. So as a major collaborator with us, they give us, the opportunity to survey their population regarding something as, as impactful as COVID, because we wanted to also understand the impact of COVID with survivors versus those that are actually, actually not well currently. We've also collaborated with Bronx Works, specifically the Living Room, which is a drop-in shelter on Barretto Street. And essentially what we've done in that space was provide Narcan, provide COVID-19 testing, provide actual test kits to take home, socks, and different goodie bags. Bronx 12 News attended one of these events, and they interviewed Dr. Matthew Martinez, who again is one of our major supporters. He was able to connect us with so many different resources, and he's one of the reasons why we had so many supplies, because he connected us with the surplus group that, you know, we went to the warehouse, we picked up goodies, and we were able to distribute masks, soap, and all kinds of different deliverables. Echo, which is the Einstein Free Clinic, again, did BP station, free clinic services with the Echo Clinic. As long as you're underinsured or uninsured, they'll see you, and they see you up to 2 times to give follow-up and then connect you to some sort of, you know, actual resource. Again, Fountain House, I've made sure that they come in at different events and provide the mental health support and resources that we needed. Paseo, which is run by Sandra Reyes, who's one of our steering committee members. They give out food. They do a food pantry every Friday, and they are, you know, super amazing with the produce that they give out. But she says she doesn't have, as the demand has increased and the supplies that she has does not actually serve the population any longer. So she's looking for support. But still, our steering committee again is the main source of all these different resources. Next slide, please.
Yes, and I think Susan had a question. I think it's 800 Barretto Street.
Yes, it's 800 Barretto Street. The living room is 800 Barretto Street. That's correct.
Is that near the elementary school,
It's in the South Bronx, across from Southern Boulevard,
Hunts Point area?
Hunts Point area. You got it.
Okay, there's a school nearby, so I'm wondering if they know, there's two schools nearby. I'm wondering if they have ideas. I will speak to someone in the school tomorrow, and if anything, then I will reach out to you guys.
Yeah, there's exactly 2 schools, and they're equidistant from the living room. I know the exact schools that you're referring to.
48, and there's a charter school in there. No, yeah, 48 and 424. I know them too.
Okay, awesome.
And through our programming, and we will have to update this map, we've nearly reached all zip codes of the Bronx. So we've had some interaction with respect to community-based organizations of the Bronx, as well as community members through our programming, as well as connecting individuals to resources in the Bronx as well.
So this map is just basically respondents that we've, you know, done. The last data dump was in 12/22. We're going to do another one shortly. And this just breaks down the race and ethnicity of the people that have responded to us. Next slide. So this is just the gender and the neighborhoods that we service, as Danielle alluded to. We've gotten majority of the zip codes, and we've made sure that our events are as widespread as possible so that we're catering to majority of the population, even though more women are the respondents than men. But we have definitely tried to make sure that we've done, you know, the barbershop events to make sure that we're including more male perspectives as well. But we'll see with the updated slides. Next slide, please. So trusted vaccine information sources. Surprisingly, with all the controversy and the political attachments that came with the information, our population still refers to the CDC and FDA, et cetera, as their #1 source, followed by their providers. So it's great that they're still looking up the information and trusting the information, because that was important to make sure that they knew that this was, you know, unhinged, it was untainted information, it was pure generic information. And that our doctors and our healthcare professionals were definitely trying to support the population and did not have a political agenda. Next slide. So just to go through our next steps and not bore you any longer, we're ready to do the Health Street model. We've actually started doing the Health Street model. The Health Street model basically is where we go into different community settings and we interview individuals for about 20 to 30 minutes. And what happens in this model is that they get services or whatever concerns or resources needed. It's typically like a pre-health screen, and then we refer them to actual health screenings, if that makes sense. So it's questions about community awareness, is questions about, clothing closets, toiletry programs, dental products, anything that is of need that may not be, currently available to our different individuals that are willing to take the 20 to 30 minutes testing. Well, it's not testing, but like, it feels like testing because they're asking you everything about your life. And they sit down and we'll basically compile the information and then refer out to different resources. And essentially, this is just an infographic of what that model looks like, because we want to make sure that, participants know what exactly they're going to do when we ask them for this 20 to 30 minute time frame. And so when they go through this process, they're essentially, giving us information and access to their most vulnerable needs. And so we go through the process and we look for resources to match what their needs are. This is a picture of what the actual forms look like, and they're quite lengthy, as you can see. And essentially, we go through and check all the boxes and respond accordingly as the individuals, give us access to their personal information. In our next slide, Danielle will just go through what is pictured here.
Yes. And just the remaining slides will share of upcoming events as well as some photos from events that we've attended and have tabled at. At the YMCA Castle Hill, we attended Healthy Kids Day in last year, and we we invited other collaborators, including the Bronx Oncology Living Day program, as well as Essen Health, who provides vaccines, as well as Bronx Fountain House, who provides information and resources for mental health. Here are more photos from that day, our team collecting surveys of perceptions, as well as providing antibacterial wipes, sanitizer, and media as well. And here are other photos from health outreach events in 2023, as well as this year. So we are, outside, inside, depending on, the weather, but even when it's cold outside, we'll be outside just based on the needs of the community and based on what we're able to, who we're able to connect our community members with. And here are upcoming events with Community Board 11, as mentioned before. March 16th, this Saturday, we'll be at the Brady Court Community Center's flea market, in which we will be signing up individuals for vaccinations for the event, in which we will be partnering with Sun River Health to provide COVID-19 and flu vaccinations. So during the Brady Court Community Center's flea market on April 13th. And then June 23rd as well, as mentioned earlier today, we will be tabling and connecting our vaccination units to the health fair. And if you have any questions, thank you for your time. We ran over a little bit. And if there are any other events in Community Board 11 that you think we should attend, please let us know.
Definitely. And we can talk offline for what specifically you want for these 3 events that Danielle just showed, so that we can make sure that we're addressing the population that is needed and the services that are wanted.
Go ahead. Well, thank you so much. Very informative. And we look forward to having you attend the health fair. And we will definitely set aside at least 3 to 4
We
tables
have
for
many
you.
tables.
Right?
Yes,
And
so when we talk
Danielle,
offline,
get in contact with me so we
yes,
can work things out.
definitely. So we'll set aside. I'll definitely engage with Fountain House tomorrow to see if they're available to attend. and they can provide mental health services because that's their thing. They love that.
Is there a way you can send us the PowerPoint?
Yes.
Yes.
Yeah, and is
In the
any of
chat.
that
I put it in the chat earlier.
chat? Okay.
Yeah, it was in the chat. I can repaste it. Or Danielle, do you want to send it as a
Send it
Attachment.
as an email that we can distribute it to people who are interested.
Right, if you send it to my email, and then I'll send it to the board or Jeremy, and then
Yeah.
let them do it.
Right,
Okay, sounds good.
Thank you.
great.
Anybody have any questions or any thoughts? A wonderful presentation.
Thank you.
Thank you.
Thank you for your time. We appreciate you having us.
Oh,
Yes,
you're
thank you.
quite welcome. And we look forward to seeing you.
Definitely.
Thank you. Yeah. Okay. Now, we were supposed to have another speaker. Is Dr. Cortell here? Cutler? I guess not. I thought he may have been, would be in person.
Because it would be an hour, he should have been here, so
Yeah.
I don't know if he's gonna,
I don't know.
I don't
I
know.
mean, I was told by John Doyle that he was coming and he was looking forward to it, but I guess not. So then we can look now then at some old
Just a quick-
business.
sorry,
Okay.
Just a quick question about your IG page. I get two different BX pandemics. One is BX_pandemic and one is BX pandemic, all one word.
I think the updated one is the BX pandemic one word. What was the last date a picture was posted? Because we had created one earlier and then,
October 2023?
no, it should be more recent. Because what happened? was-
January 10th.
Yes, January 10th.
Okay.
Because the previous person who created it has left the institution. And so we didn't have the information to post to it.
Got it.
So
All
we
right.
created a new one. So the one that just January 10th, 2024 is the newer one.
Okay. The community board is not following you.
Thank you. We appreciate the follow.
Thank you. All right, so now the health committee, we'll just discuss some old business. I've been getting some recommendations for the health fair, Cynthia, Serena, and the pandemic. So if anybody else, and even someone from the community gave us the name for BOLD, the BOLD program would be.
Yeah, the
Yes,
BOLD
sir.
program is fabulous. We can definitely engage with them.
Yeah,
And they can attend the health fair.
yeah, well, they are coming to speak in April. Dr. Modell,
Allison Modell, yes, she's
Yes.
amazing.
so she'll be here and discuss the
She's
BOLD
fabulous.
program.
Yeah,
And maybe they will also come and want a table.
yeah, she's fabulous.
I know. I mean, talking to her on the phone, she so exuberant and vivacious and
Yes.
phenomenal. So, okay, now getting to the old business
Okay,
of
well, perhaps, do we have anyone for the
the
gallery?
gallery
section?
who has any questions or whatever.
Danielle and Heather, if you guys want to stick around, that's great. If you have other meetings or other obligations, you can, you know, you can sign off if you like.
Yeah, I have a very exuberant 4-year-old that
Okay, there you go.
Understood.
just busted in the room. I was gonna stick around, but then he busted in the room, so I'm like, uh-oh, maybe
That's
I
quite
shouldn't
all
go.
right. That's
But I
quite
would
all
love to attend. How often do you meet monthly? I would like to attend
right.
because
We meet monthly except
I'm
in
in your
the,
district.
well, the health committee meets monthly, second Tuesday normally of the month, except for July and August, not unless there's really something coming up.
And
So-
where do you normally meet at Bronx
The
House?
office.
The office.
At the office. I just was able to get Bronx House to, allow us to participate and hold the health fair there.
I thought you used to meet at Einstein.
The full board
The
does.
full board
Yeah.
does, but this is just, and the full board, your presentation would be limited to 2 to 3 minutes.
Yeah, it really.
This
Okay,
way,
got
it's
it.
on tape, and the people will see it on Facebook and YouTube. That's why I encourage, to come here first.
Got
that-
it. Okay.
Set the stage, and you'll get so many other people to see it throughout the community.
Okay. But yes, I will definitely engage with your group and attend as many meetings like I can.
Thank you.
Terrific, thank you.
Thank you so much. I appreciate your time.
You're
Have a
welcome.
great night.
Have a
Thank
great
you.
night.
Good night.
Good night.
Good night.
All right. So the old business is some of the places that I've gotten in contact with through recommendations, but if any of the other people on the health committee have suggestions or know something, we can do it. But I have, the blood center will come, the woman who came, she's gonna be there. AARP, the pandemic problem, which now we're gonna increase it to
Right,
even more than 3 tables. I've contacted the fire department to come with, information to hand out. And someone from plant-based foods and nutrition, and then
They've come before.
they've come
Yeah.
before, and then I'm working on Oak Street and Clara to come, but if anybody has other suggestions or knows, please let me know so we can, fill up the room.
Especially if you work in the health field, and you have contacts, that would be very helpful.
Helpful.
So,
All right,
you could just email.
just email me and I'll take it from there. And hopefully, as we get closer, we'll help out. But I know, I've spoken to Bronx House. We're gonna have, I asked them for a double horseshoe, which we've had before, so we could
Yeah, it
work
worked
it
out
out.
very well.
It worked out well with tables. And then I'm trying to get someone from Bronx Psychiatric to come to talk about their new initiative for a community-based wellness center. So we'll see how that works. And maybe some of you filled out the survey that did you?
Which one? The Bronx Psychiatric one?
Yeah.
Yes, I did.
Great,
I did that
great, yeah. So hopefully they'll come and either do another presentation and be there, but I worked for years to get that center to open.
Yeah.
The building remained renovated and unused
Oh,
for
wow.
years, for years. So that's it for tonight. I thank you
So-
all for coming. Any questions or
Any
comments?
new business
Any new
or
business?
I think Efren wants to speak.
Efren, oh, yes, you have your hand up. Efren,
Yes. One more thing I would add to that is the services that provide health support care for the blind and for the deaf mute, because I'm looking, and I know that there's I was told that there's some organizations, some clinics that they do that in the Bronx. I'm looking into that. There's a social services that in Manhattan, an agency that deals with the deaf, that they provide services and assistance. So I'm going to try to link that to get that to you for the health fair. That's a question that happens. I mean, we have sign language interpretation in the emergency department. So I was just thinking, we do have people that come in. Some of them are children, and some are adults. So it's just something that I like to see. Maybe we could help get that to you, because that's, to me, something very important, because it just covers everything.
it is, Efren, just, you have my contact information. So just let me know who
Yes.
I should contact, or have them contact me, but let me know. Yes, it's a great idea.
Yes. Okay,
Thank you.
great.
We-
You are.
The letter in support
Oh,
for Dr. Katz.
right.
And
Jeremy
it's
just
written-
handed-
It's
Jeremy just handed us the letter for a support for the nurses and residents at Jacoby. And so we're ready to send it out.
thought
want
we
me to
voted
read
on
it?
that the full
I
board last
Voted
month.
on full
Yeah,
board.
it was, but he finally got it done and found out who to send it to and blah, blah, blah. So he just gave it to us now.
I mean, I still don't like I like to have a formal address. Which is.
Oh, I don't know. We,
Oh,
President and Chief Executive
Whatever.
Officer, but,
I think so.
here, do you know it? Wait,
can find it.
we
We
might,
can
we
find
might
out.
get it,
But we
Jeremy.
don't need to do this in committee.
Yeah,
Right.
Just for after the meeting.
Right, okay.
Right. But it looks good.
Okay.
You wanna see, just take a quick look,
Absolutely, thank you.
take a look at it, but it looks good.
Is there anything else we need to discuss?
No, I think we're.
You got it.
Okay.
Right, well, that's-
Should we make a motion to adjourn?
Yes, we're gonna make a
I
motion
make a
to
motion
adjourn.
to adjourn.
Second.
Second, so thank you, everyone. We're
Thanks
adjourning.
for coming to the.
Right.
meeting.
Good night, everyone.
Good night.
Everyone.
Right,
Take
so,
care.
yeah, because but
Jeremy, you still there? You can stop the recording.
I think
Oh.
he did.
He did?
He did.
Yeah.
Yeah, I saw
No,
it.
it's still.
No, it's still recording.
Still recording.